Good evening. Another concerning day when it comes to the pandemic as case numbers continue to soar in British Columbia. More than 400 new cases reported today despite high vaccination rates and a push to get even more people inoculated. So, what is the government's plan to slow the spread? CTV's Penny Daflos is following this. So, Penny, how are infections continuing to spike when so many people are vaccinated?
A couple of reasons, Scott. Firstly, even though nearly 4 million British Columbians are vaccinated, there are nearly 1 million who aren't. And that means they're vulnerable to the second reason, which is the Delta variant. It is more contagious and starting to strike unvaccinated people.
The vaccination blitz on walk-in Wednesday was the reason for the press conference.
33,277 shots were delivered, which is a significant number.
But the surging COVID numbers was a thornier issue as BC hit 402 new COVID cases, the biggest single-day infection rate of any province.
Yes, we expected that we were going to see increased numbers of cases.
BC's top doctor points out there aren't many people in hospital and no one has died, but admits it can take time to see a rise in hospital admissions for COVID. Aside from the indoor mask mandate and a few other restrictions in the hotspot of Interior Health, she doesn't plan any more restrictions for the time being, even though all health authorities are now seeing more cases.
Being immunized, that's our tool right now that is working to suppress cases and to manage outbreaks.
But the Delta variant, which is now the majority of infections in BC, is much more contagious. There's widespread consensus among experts that 90% of the entire population would have to be vaccinated to stop Delta in its tracks.
I've always said I think we should be using all the tools in the toolkit. If we need to be adding masks, we should be doing it.
This time last year, average cases were down to just 38 a day with 9 in hospital. So how could we be so much worse off now with vaccines?
Part of the difference is we've reopened a lot more. We're doing a lot more activity than we probably were last August. But we have really transmissible variants now. This is not the COVID that we had before. It's almost like a new virus.
But Henry is continuing her strategy, primarily relying on vaccinating our way out of what's shaping up to be a fourth wave.
Even a small increase in immunization across the age groups makes a massive difference in whether we see a wave that is big or something that is more of a ripple.
So, Penny, you touched on last year's infection rate in the summertime. As you mentioned, it was much lower a year ago. So how do hospitalizations compare?
You know, Scott, they're roughly the same. Hospitalizations are representing about a quarter the number of new cases. But remember, we shouldn't just be looking at the number of people in hospital or deaths. Each person who tests positive has a 1 in 3 chance of long COVID with symptoms that last months or longer. Nearly all the infections in BC are in people who were unvaccinated, Scott.
Okay, thank you, Penny.